well after my surgery. I'm
Oh,
doing
my
well.
goodness. You want to talk about that really
Well,
quickly?
yeah, it was knee surgery. So I tore a meniscus. You know, everybody's going to get in shape overnight, right?
Right.
So, so I tore my meniscus, but the surgeon said it was a minor tear.
Okay. Wow.
So I'm grateful. So we had the surgery on Tuesday.
Wow.
And I'm trying to be
Obedient.
an
Right.
obedient patient.
And we know that's very hard.
But it is. But I'm excited that Dr. Williams is with us. He's one of our board members, as a matter of fact.
Mm-hmm.
And his contribution is always significant to our board and its governance. So we welcome him this morning as well.
Dr. Williams, good morning.
Good morning, and good to hear Dr. Pollard's voice, and glad to know the surgery went well.
Oh, it did, Dave. Thank you so very, very much. And thank you for the work that you are doing. I guess my first question to you is based upon your TED Talk, your very famous TED Talk. Is racism making us sick?
Mm-hmm.
The short answer to that is yes. Racism is making us sick, and this is just not a statement. It's just not just an opinion. We have a lot of scientific evidence now that racism makes us sick in many ways. And one of the ways it makes us sick is the stress of racism. The fact that we are treated differently and treated unfairly, that causes psychological distress. It causes negative emotions. We don't feel good about people treating us badly. And those negative emotional responses actually lead to physiological changes in our bodies that causes us to get high blood pressure at younger ages, causes us to get diabetes. And there are now scientific studies that indicate all of these mechanisms and processes, not just on our mental health, but on our physical health, by which the stress of discrimination leads to poor health.
Wow.
What is important, though, I think a lot of people like to think about racism making us sick because of the stress of discrimination. And while that's important and while that has been neglected, it's not the most powerful way racism affects us. Racism affects us most powerfully through what researchers call structural racism and institutional racism. And what they mean by that is not about how an individual treated you, but the policies that have been put in place by society that restricts access to opportunities. Why is it that more black people live in places where they don't have access to the best elementary schools in America? Why is it that we live in places where jobs have moved out from our communities to suburban communities that do not have public transportation for us to get to where those jobs are? Those are the most powerful effects of racism. It's the access to opportunity at the neighborhood level that restricts us in terms of access to high-quality medical care, access to quality city services across a broad range of domains. But those are institutional structural mechanisms that are beneath the radar screen of most people.
So Dave, now, as a trained academic and as a respected sociologist, I want to, just for the benefit of our listeners, when we talk about, so let's do a few definitions.
Yes.
When we talk about institutional or systemic racism, what are we talking about? Because that word is hot today, given the George Floyd execution. And some say lynching, right? I mean, I heard Judge Greg Mathis the other day make a compelling case that this was the equivalent of a lynching. We watched the slow death of an individual, just as people gathered to watch lynchings, and it was sport back around the turn of the century. We watched a man slowly die, and he equated it to a lynching. Tell us, and systemic racism, you don't find much in the protest movement today that says it doesn't exist. But what is it? What is it today? And how would we define it so listeners can have a handle on it?
Sure. I mean, it's a great question, Dr. Pollard. Systemic racism refers to the racism, and by that we mean the belief in the ideology of inferiority, the belief that some groups, some racial groups, and historically in the United States, whites are at the top of the pecking order, and other groups are all beneath, with African Americans at the bottom.
Wow.
That belief. And based on that belief, we develop policies. We develop normal ways in which social institutions operate, where the people in the institution doing their job may not have any racial prejudice in their own heart, but they are administering policies that have negative effects. I'll give you one example that we haven't thought about. There's a congressional election study done, which looks after each presidential election, assesses different aspects of the process by which Americans voted. And in the 2012 presidential election, this study looked at how long did Americans wait in line at a precinct to vote linked to their race. And they found that African Americans waited twice as long. Whites waited about 12 minutes. African Americans waited twice as long in a precinct in order to cast their vote in the 2012 presidential election.
Wow.
Now, importantly, none of that reflected the behavior of the local precinct workers. It's not that local precinct workers were calling blacks out of line and saying, no, you got to stand and wait, let these white people go in front of you. No such thing happened. They were just doing their job. What it was linked to was institutional and policy that had been put in place. It was linked to how much money, what was the size of budget that was allocated to support voting in different areas of the city. And it turns out in areas where African Americans voted, the budget was smaller, the staff was smaller, the space was smaller, the number of machines available to vote was smaller. So African Americans ended up waiting twice as long as white people to vote, but it did not reflect the staffing or the way they were treated when they showed up to vote. It was built into policies and procedures, budget and space and staff hiring and the size of place that was being used, but that nonetheless produced unequal outcomes. The bottom line is you still waited twice as long to vote, even though the people at the precinct didn't treat you badly.
Wow.
And that's what we call institutional and structural racism.
Wow, that's powerful, Dr. Williams, powerful. I want to circle to something. As you can see, to our listeners, everyone, this is a fairly heavy discussion we're having this morning, but it's an important discussion.
Yeah,
Dave,
it's
as we think,
that we understand. If we don't identify,
exactly.
Right.
we can't move to address them.
That's
okay,
right.
so when we think about the racial hierarchy that you described,
Yes.
and of course this ranking of human species that began by Carolus Linnaeus as he tried to classify human beings. I mean, much of this starting in the 14th, 15th century. Not to be too academic, but it's important, though, because it forms the subtext, the historical subtext, don't you agree, Dave, against which people of darker hue have been interpreted so that once we are classified as one level above the anthropoids, as Samuel Morton said in his book, Crania Americana. That's when they were doing all the craniological studies, size of head, et cetera, et cetera.
Right.
Some of them were done at Harvard University.
And some of them were done at Harvard University, exactly.
Have mercy.
Have mercy. So now here is the question, though, and I think, and here is a statistic. I'm at the Bureau of Crime Statistics now. What it shows, once you say that black people are one step away from beasts, if not beasts themselves. And that begins to affect everything. It begins to affect policing. It begins to affect the way the community is interpreted. Now, here's a statistic, Dave, and I want you to interpret it for us. 80% of the white people who were murdered in 2016, 80% of them were murdered by white people. From the 2016 Bureau of Crime Statistics, Department of Justice publication.
Right.
So let's give it some credibility. Why don't we hear about white-on-white crime? Interpret that against your interpret. How come we never hear about white-on-white crime?
Yeah, no, it's a really great question. So what we know in the United States is most of the crime that occurs within each race.
Okay.
So most black people who are a victim of crime, the assailant, the one who attacked them, was in fact African American. And most white people who are the victims of crime, the person who is attacking them is white. However, there's a history here, and there's a context, and there's stereotypes, and there are assumptions that we make that historically whites have always been afraid of black people. Well, I mean, I think if you have your knee on the neck of a population, you may have reason to be afraid.
Right.
That if that person in that population only is able to stand up, they may look for some justice. So there's a long history of fear of whites, of blacks, that led to all kinds of policies. Even after the slaves were freed, there was a desire to keep blacks away from areas where whites live, to protect fragile white women from the brutes of blacks. I mean, there's stuff like this in the medical literature of the late 19th and early 20th century, of how blacks' brains were underdeveloped, but their sexual organs were overdeveloped, and the white community need to be protected from them. There are medical journals that have articles that were written by physicians that said statements like that. So I'm making this stuff up. And so there is this fear that still continues in these United States. And so most white Americans associate even now, there's studies that show most white Americans associated blacks with crime, blacks with being violent, blacks with being dangerous, and that's what they've been exposed to as a result of growing up in this society. Those are the pictures they have seen. Those are the images they have seen on television. That's what they have been taught consciously and subconsciously. So one of the things that I say is that if, in fact, you have been programmed, and by program I mean all of the messages you have received as you were being socialized in this society, is that black people are dangerous and black people are violent, then when a white cop over-responds when he sees an African-American male and hurts that person, I would argue that we are not necessarily dealing with a bad cop. I would say we are dealing with a normal American who is deeply responding to what is embedded in his mind as a result of being raised in this society.
Wow.
And one of the things we need to do as a society is how do we change the culture? How do we change the images? How do we change the movies? How do we change the news coverage in this country that constantly portrays African Americans in a negative way? Because these processes, research says, are normal. That when you meet someone who, based on your socialization, was stigmatized negatively, you will treat that person differently without your conscious awareness. You could be egalitarian in your values. You could believe everybody's equal, but that's what's in your mind. And those processes are activated in 1/3 of the time it takes to blink your eye.
Wow.
Well, Dr. Williams,
relate and treat that person based on those negative stereotypes.
This is very helpful for me because, you know, as you talked about this, what racism really is, a systematic racism is, it now helps me understand why we do have actually black cops doing the same thing to black people.
Often
because
we do.
It doesn't really have to do with, it doesn't have to do with the color of their skin necessarily. It has to do with how this racism has really bled into everybody's heart who's been raised in I shouldn't say everybody's heart, but a lot of people, even black people who are now making other blacks victims, doing the same things that their white police officers are doing too.
All we have to do, and I'm of course I'm trying to be neutral here, Dave, but all we have to do is watch some of the rising black stars on Fox News who actually perpetrate the same stereotypes and give voice to them in ways that are unique and appear to be credible, at least to the sponsors of some of these news broadcasts.
Well,
Dave, would you?
There may be two processes going on there.
Yeah, absolutely.
We need to distinguish. On the one hand, yes, these processes that I talked about, that we call them implicit biases, This is not about skin color, it's about what's in your mind.
Right.
And what the research shows is that at least 70% of all Americans have an anti-black bias. 70%. That's 70% of doctors, of lawyers, of teachers, of all racial ethnic groups. The only exception to that is African Americans.
Wow.
But among African Americans, 1 in 3 have an anti-black bias. 1 in 3.
Wow.
Okay? Because
1 in
it's not
3.
about your skin color, it's what's in your mind. I do want to quickly say that there are black folk who benefit from racism and benefit from racial oppression. And I remember during the days, I'm going back, but you see where I'm going. During the days of apartheid in South Africa, I spoke to a black psychologist from South Africa who was working at the University of Zululand, and she was explaining to a class of mine, she was a guest lecturer in, of how there are black people who benefit from apartheid. And this was this, that the white infrastructure was maintained based on black informants. And there were black people who would be paid by the apartheid government to be a spy and report on activities. They acted as if they were together with the rest of the community, but they were being paid. They financially profited. And she said, do you see when we do what they call necklacing, when we take a tire and burn it around somebody, that's when someone who was an informant was found out. That's the way the community responded to treat them. And the point is, there are some black folk in America. You say the right things. You say what people would like to hear. I'm not going to call any names. We have some examples of people like that. And they'll take care of you. They'll take care of you financially and otherwise if you are black and you're willing to say what they would like to hear to make them feel better.
Yeah, and you know, of course, Dave, some of the people have said, some of those persons have said, we're trying to make George Floyd a hero. We're not trying to make him a hero. We're trying to make him human. That's exactly. All we're trying to do is make him human, insist on his humanity. Dave, another question for you, Dave, before we begin to wrap up. And I was going to ask you about the implicit bias studies that was so famous, but you've already spoken about those. Talk a little bit about healthcare disparities, because that's also one of the very prominent areas of your research and your articulation. I heard you the other day on Fareed Zakaria talking about some of this data, but would you say something about why do we have health disparities in such dramatic proportions as we do? And what can we, and you mentioned Oakwood in one of your TED Talks, what can we as an HBCU do to help advance health among these populations?
It's a really great question. Let me try to be brief because
I know.
But let me try to be brief. First of all, we have health disparities because African Americans disproportionately live in places where the conditions to be healthy are not present. When you live in a neighborhood that has higher levels of stress and more poorer housing conditions and doesn't have access to safe places to exercise and doesn't have access to full-service supermarkets that sells groceries and fresh fruits and vegetables at a good price. And then you experience higher levels of stress because of the violence and the victimization that you and your family experience because of where you live. And then on top of that, you have the stress of discrimination. All of these stressors add up. And what research is telling us, that black people in America are literally aging biologically more rapidly than whites. So you look at a 50-year-old white person and a 50-year-old African American, they're both the same chronological age, but from how their body is functioning, the African American is 7.5 to 10 years older because of the constant exposure to adversity. Let me break it down. One researcher calls it weathering. Imagine a drop of water from the rooftop of the building you're in fall into the concrete sidewalk below. If it falls today, no big deal. But if day in, day out, week in, week out, there is a drip, drip, drip of water on that concrete sidewalk below, it becomes weathered. It becomes eroded as a result of the constant assault of adversity. And what we are saying, what research is telling us about African Americans, our age is not only saying how long we have lived. Our age is telling us how long we've been exposed to bad environmental conditions and how much the negative accumulation of all of the stress we are dealing with, we've been exposed to. And we are literally, our biological systems are becoming dysregulated faster because of our exposures.
Wow.
And what?
So,
And go
what
ahead,
can we
Dave.
do?
Please. Go ahead, please. I was going to
We
follow up with
certainly
a question.
need to ensure everyone has access to good care and high-quality medical care, but we need to do more. We need to work within our communities and ensure that every child is put on a foundation for high-quality education and good early childhood supports. And we can provide parenting skills to people in our communities so we can do the best for children. We need to ensure that every child has access to high-quality education and gets the skills so that they can be equipped to support and provide for their families in their homes. We need to look at our neighborhood environments and ensure that we get the policies in place. I call for a Marshall Plan for disadvantaged communities, just how we helped to rebuild Europe after World War II. We need to look at all disadvantaged communities, black or white, and ensure that every American child has access to the opportunities of American society that will not only improve their health, it will improve their economic productivity, it will be good for the nation, they'll pay into the Social Security system. All of us is going to benefit if we do that for all.
So, Dave, I want to issue you an invitation.
All right now.
As I've done many times before, but I want to issue you an invitation. I've had you come for graduation, a number of different things. On next Wednesday, in terms of community impact, Oakwood University has two things happening next Wednesday. We have the grand, and you can't make it next Wednesday, that's okay, but the grand opening of our Oakwood Farms, which also helps to speak to the food desertification, the food desert area here in the Northwest Alabama. That opens, our grand opening is next Wednesday. But we're also doing a groundbreaking for the Community Health Action Clinic. And about 8 months later, we're going to have the grand opening, timing it right around the time of board meeting. I want you at the Community Health Action Clinic to be the keynote speaker. That'll be in April of 2021. I want you to be the keynote speaker, and I want you to talk about the impact that an HBCU can have on the health, on a healthy campus and a healthy community.
Amen.
Absolutely.
Any final words for us? What are some things that you think we on the ground can be doing to advance health among the people groups that we serve?
I would say to all of us, and this is we are Christians, and we follow the Lord Jesus Christ, and
Amen.
we look at the example of his life. The Bible said he went about doing good.
Amen.
And if we can do good, just how we treat each other on a daily basis, and we can do good, just as Jesus went about and met the real needs that people had. And if we can follow in those footsteps, we can make a difference for everyone we encounter every day.
Dave, thank you so very much. Thank you for serving on our Oakwood University board. Thanks for the guidance that you give in our academic areas. And thank you for the mission and the ministry you're executing there at Harvard University. Thank you very much.
I believe in Oakwood. I believe in what you're doing. So this is a wonderful moment for us to rally around and move forward with the Lord's work that he's given us to do here. Thank you.
Amen.
Amen. Thank you so much. This has been a special edition of Inside Oakwood with Dr. Leslie Pollard and Dr. David R. Williams of Harvard University, a professor there. Thank you so much for being with us. Join us again on Monday at 8:30 for another special edition of Inside Oakwood with Dr. Leslie Pollard.